Dear chairs, dear audience, I'm Péter Misnyovszki, and I'm here to present my 12-month progress on my PhD topic, which is clarifying violent death cases through the assessment of diagnostic methods and the identification of risk factors. So, as it was mentioned, I also work as a forensic resident in our institute, and my vision is that in the near future, autopsy will be an integral part of the postmortem evaluation worldwide. And to reach this, we work on the assessment of postmortem diagnostic methods and finding and identifying different risk factors. So, to do this, we have two ongoing projects. The first one is about the diagnostic methods, and the other is about the risk factors. In our first project, we run a systematic review and meta-analysis on the postmortem radiological assessment. What are these modalities which we looked for? The first one is postmortem computed tomography. The second one is postmortem magnetic resonance imaging. And the last one is postmortem computed tomography with angiography as a contrast material. Why is this topic important for us? There are more than 1.25 million of autopsy cases only in the EU each year, which is really a tremendous number, and there is a clear public demand to curtail this number, and also the human researchers are lacking to do all these work. And it is also presented as the United Kingdom has already implemented this autopsy technique, and you can see that it's cheaper and more human resource effective than the conventional autopsy. So to prove our point, we posed the question whether postmortem autopsy techniques can replace autopsy. Thus, the hypothesis is if they reach the diagnostic parameters of the gold standard autopsy, then they can do so. Our population was all the deceased who underwent the autopsy and at least one of the postmortem autopsy modalities. The intervention was the postmortem autopsy modalities. The comparator was the autopsy, and the outcome was the diagnostic parameters. After careful selection, we were left with 102 full text to extract the data from. Okay, so let's delve into our results. As you can see, the sensitivity and specificity are shown in the two-dimensional visualization in our slides. The further in the left and upper corner, the blue dot, which is the result, is the better the diagnostic method in detecting said parameter. As for the cause of death, as you can see, it's not really up in the left upper corner, unfortunately, and is not to be preferred as a standalone, but can be used as an accessory with autopsy. As for cardiovascular diseases, you will see that there is a contrast agent required for proper results. For neurological diseases, you can see that the specificity and the NPV are quite high, thus it can be used as to exclude neurological diseases, while it's lacking in sensitivity and PPV to be a proper standalone method. As for respiratory disease and skeletal injuries, you will see that most of the diagnostic parameters are quite high, but unfortunately, PPV and specificity are low because of some reason. And most likely, this reason is that there are lesions which are usually not detected by autopsy, but can be seen in postmortem CT, for example. Thus, because of our methodology, these are seen as false positive cases, reducing specificity and PPV, and this will be addressed later. Respiratory and skeletal injuries, as you can see, are on the left upper corner, thus they can be used as a standalone method. Soft tissue injuries and bleeding is similar to neurological diseases with a high specificity and NPV, thus could be used to exclude. The results for PMMR, cardiovascular diseases, and neurological diseases are also quite on point, and they can be used. I would like to highlight in this topic that there are results on lesions on acute hypoxic injuries to the brain tissue and the heart tissue, which cannot be seen in autopsy in any way. Thus, PMMR is the go for in those cases. PMCTA, we only had enough cases for cardiovascular diseases, but you can see that the diagnostic accuracy is really high. Thus, this can be used to replace autopsy. So to cope with the false positive cases, we used two types of statistical analysis to find whether the reference standard was working properly or not. The Metatron compares the reference standard to hypothetical reference standard calculated from all the data we had available, and it found that autopsy is not behaving as a reference standard, and the HSROC even gave us results on the actual numbers and the actual diagnostic parameters of the reference standard. The HSROC is a more complex statistical analysis. So here are the results. As you can see, the calculated sensitivity and specificity of the autopsy is 4 from 1.0 that one would expect from the reference standard. And it changed the sensitivity and specificity of the postmortem virtopsy techniques. Also, you can see that in the case of cause of death, it is similar to autopsy. In the cardiovascular diseases, it is still lacking because of the lack of the contrast material. In the case of skeletal injuries, the PMCT is working much better. Traumatic injuries, it's almost the same. And in case of PMCTA, it's still working better than autopsy. So to summarize, we have gave the way to find the most efficient modality based on the lesion. We have a proof that in natural death cases, when cardiovascular diseases are present, we can replace autopsy by PMCT. And we have to further investigate the improper reference standard and evaluate mixed postmortem techniques such as external examination plus PMCT. We had strengths, which is the largest up-to-date meta-analysis present as of now, and we had unfortunate limitations because of the reference standard and the high heterogeneity. And as a conclusion, PMCTA to replace autopsy in cardiovascular, PMCT for respiratory and skeletal injuries, PMMR for acute hypoxic injuries, and autopsy cannot be accepted as gold standard, highlighting the requirement for other investigation methods. All right, so we are working on sending it to internal review. Our second topic is forecasting by weather, which is registry analysis in the association between environmental parameters and suicidal death cases. So this is an important topic because we have more than 1,500 suicidal cases in Hungary every year. There are available publications throughout the world, but unfortunately they are indecisive. And our aim was to analyze our registry and to deduct from that. population was the population of Budapest, Pest, and Nógrád counties. The exposure was a change in the meteorological factors such as temperature, wind speed, precipitation, and we wanted to know whether this has an effect on the incidence of suicidal death cases. And the registry is a single center registry. We have all the non-natural cases in the relevant area, and we have more than 7,000 suicidal cases with the relevant data. And we are working on the data cleaning right now. And all right, so it just jumped through. I would say that the picture can tell more than 1,000 words. And I brought this from Gustav Doré. Thank you.
Based on what knowledge did you choose the exposure parameters, or which one to include and which one to exclude, like temperature and pressure and so on?
Yes. So most of the articles are focused on temperature and precipitation, and also some include the number of hours when sunshine was present. The real problem is how do you evaluate these factors. So whether they are used as a constant or whether they evaluate the differences between the days, so the change in set parameters. We saw that the most effect is whether there is a huge change in the parameters. So it's not that whether there is a lot of, the temperature is high, but whether there is a huge change in or drop or increase in temperature, same for wind speed and precipitation. And we would like to include all of these, what you can see here.
Are there any country where PMCT is the gold standard now for skeletal injuries?
Okay, so it's not a gold standard because it's used accompanied with an autopsy, so you cannot use PMCT as a standalone usually. PMCT is good for that. And there are countries, like Nordic countries, for Norway for example, when they have a PMCT done before every autopsy, just to focus on skeletal injuries. So they can do the autopsy better and be more precise in that way.
I have two questions for you. One is that what is your prediction with the changing weather in the upcoming years? That will there be more suicides, or will there be any psychological effect that will go against it? And the other one is now that you gained understanding of these methods of replacing autopsy, how would you plan a virtuopsy for, how would you substitute the current autopsy with the techniques that you discovered?
Okay, so answering the first question is a lot shorter. So I think that meteorological parameters, the changing meteorological parameters has lower effect than other parameters for culture, for example. But they can be used to predict somehow the distribution of suicidal cases. So that can help us. I believe that the meteorological stress that is we are having bigger changes in meteorology nowadays. So there are floods and droughts, and there are places when it's really getting deserted and desertification is going on. That could have some effect, but mostly our project is just to find whether it can show you the distribution in time. And to answer your other question, as in the UK, the NHS has this project going on, and it works like the pathologist has to decide whether he even wants to do the virtuopsy. And he or she will ask for this examination if they suspect that the lesion behind the cause of death is like for cardiac injury or something that can be found by PMCT or PMCT. and it has very high efficiency because of that. So they don't even ask for the examination. And if someone has there is a high proportion in case of deceased for cardiovascular diseases from 20 to 30% even in Hungary. So you can exclude a lot of autopsy cases because of that. And in some cases it helps you to reduce the invasivity of the autopsy. So you don't have to do a whole autopsy, you just take histology samples from the heart or the lung or the brain, and then you get reliable results afterwards.